Hi guys, welcome back to my channel Experience Arc. My name is Becky Cook and today we are going to be talking about obsessive-compulsive disorder. So when it comes to obsessive-compulsive disorder, the simplest definition for it, unwanted thoughts usually leading to compulsive rituals. So these thoughts that they have are very unwanted, it's very anxious, and they do these compulsive rituals as a form to get rid of this anxiety and to get rid of that form of stress. There's two key factors when it comes to obsessive compulsive disorder, and that is obsessions and compulsions. Obsessions are essentially those unwanted thoughts or impulses that someone with OCD has. And these obsessions usually focus on specific objects or specific areas. This could be like a fear of destruction, disarray, a fear of contamination, the fear of sexually or socially inappropriate behavior, and this can also take the form of repetitive doubts. So like the fear that you didn't lock the door when you went to bed, or the fear that you didn't turn the stove off. Compulsions are really just these irrational rituals that people with OCD will do over and over again to limit or subtract from the anxiety that these obsessions have brought on. So just a common example for this would be, right, if you are afraid, you have this obsession that you didn't lock the door before you went to bed. So now your compulsion is that you go back, you lock it. You go back to bed, you fear it again, you go back, you lock it, or make sure that it's locked. And you might go back 7 times, you might have to go back 20 times before your anxiety is gone and you can actually go to sleep. So these compulsions can involve like seemingly rational thoughts. It's just excessive, and that's what makes it kind of more irrational, is how excessive it can be. So really, OCD is kind of this balance of these obsessions that occur in your brain, and these thoughts that that different things are in disarray or they're not right or whatever. And then you have these compulsions that you have to do to essentially get rid of those obsessions and get rid of the anxiety that those obsessions bring on. When it comes to prevalence, the lifetime prevalence is about 1 to 2.5% of the population. When it comes to diagnostic criteria, the main criteria for OCD is to have obviously these obsessions and then these compulsions. And these obsessions, when it comes to diagnostic criteria, essentially causes the person with OCD to attempt to suppress or ignore these obsessive thoughts. Typically, they will have to try to neutralize them with some form of action or some form of doing. And then these compulsions are expected by people with OCD to somehow magically, reduce that fear, reduce that anxiety, and make those obsessions go away. So it magically prevents some sort of dreaded event or situation. Kind of like phobias, another diagnostic criteria for this is that at some point with this disorder, the person with it recognizes the fact that it is very irrational and excessive. When it comes to the obsessions and compulsions, they have to cause significant distress, be time-consuming, or interfere with a person's normal routine for them to really have OCD. And lastly, these obsessions and compulsions will not be due to any other form of medical condition, due to taking certain medications or any other substances of that sort. When it comes to causes, the exact cause of OCD is unknown, but there are some risk factors. One of those risk factors is a lot more biologically oriented, in the sense that there's a problem between the front area of the brain being able to communicate with the more interior parts of the brain and the deeper structures that typically secrete a neurotransmitter called serotonin. Genes may also partially play a role when it comes to OCD. When discussing comorbidity with OCD, some that are very common obviously going to be other anxiety disorders, and then you can have depression with this. It can be very difficult to live with OCD, especially if your obsessions and compulsions are very time consuming and don't allow you to be productive in your life. You can feel a sense of hopelessness that it will like never go away, and it can be very difficult to deal with. Lastly, another comorbidity with OCD would be body dysmorphic disorder. I will eventually in this series get to talking about eating disorders, and body dysmorphic disorder is one that I definitely want to talk about. So when it comes to treatment, one of the best medications for OCD is an SRI, which is a serotonin reuptake inhibitor. So it's going to inhibit the amount of serotonin that your brain is taking in because it's producing too much, which is producing this anxiety and therefore this disorder. Cognitive behavioral therapy is considered to be also one of the best therapies for this disorder, which is also known as CBT. Other forms of treatment may also be exposure and response prevention treatments, as well as other medications can also help with this disorder. Thank you so much, guys, for watching this video. I hope you guys enjoyed it and learned a lot more about OCD, what it actually is compared to what we typically assume it to be. Please like, comment, and subscribe. Bye, guys.